Next question here. A nurse is emphasizes the need for a close monitoring in a patient who is taking anti-TB drugs and has a history of what? So most of the anti-TB are hepatotoxic, causes the hepatotoxicity. So we have to check the liver function test before start, and when patient continue this medication, also we have to check. So hepatitis need to check. Which of the priorities nursing intervention for conscious patient who has suddenly developed ventricular tachycardia? So what are the priority of nursing intervention? Administer quinidine intravenously. Next question, a healthcare provider order enoxaparin. It is the anticoagulant medication like heparin, warfarin. So patient taking this medication at 1 milligram per kg every 12 hours. Which patient is most likely to have this medication administration in subcutaneous tissue to the upper arms? Which patient is most likely to have? The patient who has a total hysterectomy. Question number 12, a nurse is developing teaching plan for a patient who is taking disease modification anti-rheumatic drugs. For his arthritis, doctor prescribed disease modifying anti-rheumatic drugs. Which of this should be included in teaching plan? This medication will control the side effect, should be seen after several months. So we continuously monitoring the side effect of modifying anti-rheumatic drugs. A patient who taking methotrexate call the clinic and state, I am just so tired all the time. I never felt like this before. Which of this is the best response by the healthcare provider? Methotrexate. It is chemotherapies. So response is, are you having any bruise or bleeding in the body? For further evaluation. Next question here. A nurse is preparing discharge instruction for the patient who is receiving enoxaparin. Which of these is or are important instruction the patient should receive? Learn to give subcutaneous injection, understand the importance of avoiding over-the-counter drugs, and observe for unexplainable bleeding. Next question here. A patient prescribed fibrinolytic therapy. During administration of fibrinolytic agents, the nurse recognized that the therapy should be stopped when the patient experiences what? Fibrinolytic therapy. When patient experience sudden decrease the level of consciousness, we always inform to the healthcare provider. The nurse is teaching a patient with a stable angina who is starting the sublingual nitroglycerin. Which of these statements indicate that a patient understands the correct use of nitroglycerin? Nitroglycerin is a drug of choice for angina, but it used sublingually. So if the patient say, I will seek it medical attention, I look for the medical attention if any chest pain is unrelieved by the 3 nitroglycerin tablet. So if you take 3 nitroglycerin tablet consequently, and still if you have a pain, you better to call 911. The healthcare provider order heparin 15,000 unit sub-Q every 8 hours. The strength of the level is heparin is 10,000 unit per ml. How many ml will the nurse administer? So doctor order is 15,000, medication in hand 10,000, volume is 1 liter. 15,000 divided by 10, so it would become, what are the result will come? That is the ml will nurse administer. Question number 18. The nurse is caring for a patient who has pulmonary embolism. Intravenously heparin is prescribed in evaluating effectiveness OD. This twice a day. A nurse recognized that the expected outcome administration of heparin is an activated partial thromboplastin time twice the normal values. It indicates or expected outcomes. It is normal for the patient who is undertaking the anticoagulant therapy like heparin. Next question, a patient with an acute myocardial infarction is receiving the tissue plasminogen activator. Which of this action is priority for the nurse to take? Right? Monitor the sign of bleeding. So tissue plasminogen activator, we always check for sign of bleeding, like epistaxis, ecchymosis, petechia. Next question, a nurse is caring for a patient with a stable angina. Which of the following would indicate the correct understanding of action of nitroglycerin? Nitroglycerin dilate the arterioles and decrease the afterload.